Hi, I'm Dr. Noreen, working as an ED physician in MOH Kuwait and doing my MSc from South Wales. Today we will be discussing about the microvascular complications of diabetes. First of all, why diabetes is so important to be discussed and its microvascular complications. Because one of the major complications is by the retinopathy. Due to retinopathy, most of the people lose their vision and it causes blindness. In 2014, 8.5 people aged over 18 years and older had diabetes. In 2019, more than 1.5 million deaths occurred, whereas this is 48% of all death occurs before the age of 70 years. Whereas due to awareness for the non-communicable diseases and probability of dying from them decreased by 18%, this video is one of the contributions to add up to the good cause. What is diabetes? Diabetes is a chronic disease that occurs either when the pancreas do not produce enough insulin or when the body cannot efficiently use this insulin that it produces. Insulin is a hormone that regulates blood sugar. The raised blood sugar or hyperglycemia is a common effect of uncontrolled diabetes. With time, this uncontrolled hyperglycemia leads to serious damage to many parts of the body's system, and especially the nerves and the blood vessels. There are different types of diabetes. No matter what the kind of diabetes you have, the complications of long-standing diabetes are the same. There are major complications of diabetes. There are macro and the microvascular complications. As I told you earlier, there are the larger blood vessel complications and the smaller blood vessel complications. What is diabetic retinopathy? Retino, it means retina, and pathy means disease. Diabetic retinopathy is one of the most common cause of blindness from the ages of 25 to 65 years. Diabetic retinopathy is common diabetic eye disease caused by these changes in the retinal cells. It affects 80% of patients who have diabetes. Every diabetic patient should be screened annually for eye problems and changes. Sometimes in early stages of retinopathy, it will never affect the vision and will not need treatment if there is good control of hyperglycemia. But if there is no control and the diabetes is uncontrolled and you have retinal disease, it requires treatment and should be done as soon as possible. There are worldwide tools available for the treatment of diabetic retinopathy. Before that, let's take a glimpse on how the eye works. The light rays pass through the cornea, passing through the pupil, across the lens, through the vitreous body, that is a clear gel substance that fills the middle of the eye, and then to the retina and to the optic nerve. From there, the signals are carried to the brain and we can have a vision. Coming to the types of retinopathy, there are two types, proliferative and non-proliferative diabetic retinopathy. The non-proliferative diabetic retinopathy, or called as the background retinopathy, is the one in which the damaged blood vessels known as the pericells of the retina results in the weakening of the capillary walls and increases the blood flow, which allow the microaneurysms in retina to come outside. This in turn causes leakiness in the capillary walls of the retina, making the retina swell up. When the macula swells, it's also called macular edema. This leakiness also allows large molecules like lipids, proteins, and they come normally in bloodstream to leak out in the retina. So these molecules are not absorbed back in the bloodstream. So they stay on retina, causing known as yellow and white spots or hard exudates. These clinical findings are main characteristic of non-proliferative retinopathy. Now coming to the proliferative diabetic retinopathy. After the first two stages, that is the leaking of the hard exudates and aneurysms and all of this, when it causes ischemia of the retinal cells, where retina will compensate for this ischemia by producing a new growth factor from the growth factor known as VEGF, vascular endothelial growth factor. This causes new blood vessels to be formed. However, these vessels are abnormal and retina is not able to compensate it. These new vessels often bleed in the vitreous If there is a mild bleeding, you may see a few dark floaters in the vision, or it can, if the bleeding is a lot, and it might block the vision at all. So then after that, it can cause vision loss also. When there are new blood vessels and there is scarring, and there is a lot of bleeding in the retina, these scars can cause retinal detachment and vitreous hemorrhage. In this slide, you can see how in the vision there you can see black spots or blind spots, and the normal side of the vision is seen. Now, in this slide, you can see a normal retina, a healthy normal retina, where there are no hard exudate, no aneurysms, no cotton wool spots, no abnormal growth of vessels, and it's a healthy retina. And on the other side, on the right side, you can see a diabetic retinopathy retina. This is when you see from the fundoscope, you can see this. All right, now how do you diagnose diabetic retinopathy? First thing, when you go to your clinic, the doctor is going to do a fundoscope examination. The doctor can see and tell you how far you have been into this and how much more diagnosis and treatment you need. Another way of getting the diagnosis done is from a fluorescein angiography. It's a small amount of dye that is inserted in the arm, where it circulates in the blood vessels and all over the body, and then comes to the retina. A special camera with blue flashlight is used to take series of photos of the retina. Any blood vessel affected by the diabetic retinopathy or leakage, as well as ischemia, will be seen. Another way of diagnosis is the OT scan. A special camera is used to photograph your retina. It measures the thickness of the retina, and it is a very sensitive detective camera, and it detects the swelling and the leakage of the fluids. These scans can help us in treatment of diabetic retinopathy. What are the treatments now? The treatments, we have the conventional retinal laser, the micro pulse laser, drugs that are anti-wedge drugs. More general and non-invasive approach to treating diabetic retinopathy or preventing diabetic retinopathy is by wearing a light mask on the eyes at night, where a low level light is used to reduce the demand of oxygen and prevent hypoxia, which is starvation of the retinal oxygen. And the diabetic macular edema is reduced by this light. Alright, can retinopathy go away with treatment? No, it cannot, but yes, it can be stopped where it is. And we can stop this by causing less we can stop further damage to the eye. All right, we can be using medications, and medications are for intensive control of glucose, hyperlipidemia, high blood pressures. This can also stop the diabetic retinopathy. By controlling your blood sugar and blood pressure, you can stop vision loss. Anti-VEGF medications nowadays are available, and these medications are injected directly into the eye, and it reduces the macular swelling and improves the vision. In this slide, you can see easily how this is done. Alright, now coming to the conclusion, diabetic retinopathy is preventable through strict glycemic control, annual dilated eye exams by an ophthalmologist, and modification in lifestyle. Treating high blood pressure and quitting smoking and doing aerobic exercise are shown to protect nerves and improve the blood circulation and reduce the incidence of diabetic retinopathy. Thank you very much.